Hello and good day. So today we're going to learn about the anatomy of the nervous system. So now we will move on to learning the basic neuroanatomical terminology so that you can orientate the brain structure. Okay. First of all, looking at this model, you need to be able to understand which is the front part first, all right, in order to correctly identify the brain. So the easiest way to do this is by holding your own fist. Okay. And you can see that your fingers is folded this way and all of the other four fingers are in this direction. So this is the frontal part. So similarly, if you look at this model, the part that forms the fist is pointing towards this direction, right? So we can be confident that this is the frontal part or the anterior part of the brain. Of course, if this is the anterior part of the brain, this will be the back part, okay, or the posterior part of the brain. This is the superior, and finally, okay, this is the inferior part of the brain. Anterior equivalents to rostral, posterior equivalents to caudal, superior equivalents to dorsal, and inferior equivalents to ventral. Okay, so these are the terminologies to orientate the brain itself. This is upside down. So to orientate it, you need to put it in anatomical position like this. Okay, and checking on the fist, you know that this is pointing forward or anterior. And I can split the brain into half because there is a midline sagittal. Okay, that's what it looks like if it's cut into half. You can also cut the brain, okay, in different planes. And these planes, okay, we can call it differently as well. So if you cut the brain in such a way that is showing the structures, okay, on the horizontal planes, like this model here, okay, this is horizontal plane. On the other hand, if you remove or cut the brain from this angle, this time around, instead of cutting it this way, you're cutting it this way. Okay, this is called the coronal plane. So you have the sagittal just now. Anything that you go on this line, sagittal. Anything that you go on this line is horizontal, and anything that you go on this side is coronal. Now we're going to look at the main parts of the brain. All of these white areas are what we call the cerebrum. So the cerebrum is what consists of neurons and also cell bodies. We can see that the cerebrum, okay, has a lot of wrinkles, okay, or what we call as gyrus, okay, or plural gyri. And also in between the gyrus are the foldings, and these foldings are called sulcus, okay, or for plural sulci. If I turn it around, you can see that there are two smaller structures of the brain. For this model, it appears in a darker color. Okay, these are the cerebellum, right? So the cerebellum are more concerned with memories that are related to procedural or skills, as well as for balance, okay, and other functions as well. And if you notice, there are smaller structure here. These are the brain stem. They may appear small, but they are very important because they control a lot of functions such as consciousness and breathing, okay, focus. So this is very important. If you damage this structure, you might stay in comatose state for a long time.